welcome to The Doctor is In, your daily guide to virtual care in this time of the coronavirus. I'm Dr. Freddie Gomez, and I'm here to answer your many questions over the next half hour. We continue to discover new symptoms and ways to manage COVID-19. But as we try to understand these further, the information can be overwhelming. In this episode, we'll talk about the COVID-19 wave and its related terms. Also, we will look at newer symptoms being discovered associated with the virus, as well as ways to take good care of your teeth and gums during this time. It is important for the public to understand the terms being used to describe COVID-19. At para tulungan tayo ipaliwanag ang mga ito, makakasama natin si Dr. Carolina Tapia. Siya ay isang preventive and community medicine specialist. Welcome to the program, Dr. Tapia.
Hello, Freddie. Good afternoon, and good afternoon to all the televiewers. Thank you for having me in your program.
Now, we've heard it often in these past 2 months, habang nasa quarantine tayo, on how COVID-19 is infecting people in waves. What is a wave, a peak, and a curve in relation to a virus infecting people, and why is this important for us to understand?
All right. Maybe before I talk about the wave, I would like first to talk about the epidemic curve, but what is more popularly known now as the curve. All right. Uh, the curve
Sure.
starts with an index case. Okay. The index case is the first reported case. All right. And then, syempre, a highly transmissible disease, madaming new cases na lalabas. So you would see a rapid increase in cases. Why? Because they develop symptoms, they go to the hospital, they get tested. And then this rise in cases will reach a peak. Okay, our peak was about 500 plus around the end of March. You will know that you have reached the peak when the number of cases start to go down again. So you have the descending arm after the peak. All right. Why does it descend? Why do the number of cases reduce in number? Because of the interventions, the lockdown, the social distancing, wearing of masks, everything. All right. So it continues to descend until the number of cases are few or hopefully may reach zero, and that now signifies the end of the epidemic. So the whole cycle from the index case up to the end of the epidemic is what is called the wave.
Okay, that's good to know. So at least naliwanagan na tayo about those terms. Now, when people see information on the number of people being infected by COVID, we see them every day, the values. How can the average person use this data in order to make an educated assessment of the current situation?
All right. That's a very good question. We often see DOH comes out with data of the number of cases per day. All right. How does the average person makes use of this data? You know, we look at the numbers. If we see rising numbers, this is really very scary. But one more important way that we should be looking at these data is to see if our interventions are working. All right. Now, Freddie, I'd like to tell you, but the premise of these waves that we are being shown, the premise is our data are timely or recent and accurate because our leaders make decisions based on these data. So that's the premise. And the average tao, as you said, kung ako yung average tao, makita ko padami na ng padami, padami na ng padami, maybe I would be more scared na baka hindi na ako lalabas talaga, like, and I'd be wearing my mask really as religiously as I should, washing my hands, complying with all the non-pharmacologic measures.
Right. That's great to know, Doctora. At least now people will know how to interpret these data that we see every day. Now let's take a look at some of the social media questions na we have. Kung pwede nyo kaming tulungan na sagutin ito, Doctora. We have a
Okay.
question from Eman. Ang tanong niya is, may posibilidad ba na mas infectious ang COVID-19 sa second wave?
Okay. I think the question, siguro ang question dapat, is there a possibility that COVID-19 will be more dangerous? Okay, it really has nothing to do with the first wave or the second wave. Okay, um, can the virus mutate to a more dangerous form? Freddie, we know that all viruses mutate. And viruses have really a great propensity to mutate. Right now, yung scientists all over the world are seeing about 7,000 plus mutations of these COVID-19. Okay? Now, ito bang mutations na to ay babaguhin ba niya yung behavior ng COVID-19? Meaning, mas magiging nakakahawa ba siya? Mas magiging more infectious ba siya? Magiging resistant ba siya to the vaccine or the drugs? Right now, what the world is saying, what the scientists are seeing, although there are thousands of mutations already, it's good to know that the behavior of this COVID-19 virus is not affected yet. It's not affected by these mutations.
Okay, so at least that's one thing that's good to know. We have a second question from Grace. Bakit po nangyayari ang reinfection ng COVID-19?
Okay. Um, Actually, wala pa naman talagang term na COVID-19 reinfection, no? Unlike with dengue or unlike with TB, okay? I think what Grace is referring to is yung mga positive cases na nag-resolve, nag-negative na, and then babalik mag-positive. Okay? Totoo, meron mga ganyang cases. But world data shows maliit lang. In the US, I think it's about 13%. Okay. And then, in other countries like South Korea, they found that the amount of genetic material ng virus sa mga taong ito ay very, very, very small. Viable sila, but very small amount of material para maka-infect sila ng iba. Okay? In fact, South Korea tried to grow the virus in the lab, hindi nag-grow. And then they tested about 800 na contacts nitong mga patients na gato na nag-positive, nag-negative, tapos nag-positive ulit. They didn't see any evidences of transmission. Another good thing to know.
Okay, that is definitely something good to know. Thank you very much, Dr. Tapia, for joining us on the show and sharing your expertise and giving us a better understanding on these terms that we hear almost every day.
Freddie, may I just say one last thing?
Yes, of
All
course, go
right.
ahead.
Okay, we have all seen. We watched the world. Even the best healthcare systems got overwhelmed and devastated. So what's the lesson in all this? The lesson in all this is that all countries should put health at the top of the political agenda. Dapat talaga priority because we saw how health is the driver economy. No health, no economy. So I wish all countries would put health at the top of their political agenda. Thank you, thank you.
Thank you very much. That was Dr. Tapia, preventive medicine specialist. So we have to pause for a quick break, but when we return, we will talk about symptoms of COVID-19 that can be mistakenly identified as the common flu. Please stay tuned. This is The Doctor is In. I am Dr. Freddie Gomez. We want to make the most out of your telemedicine appointment today, so please send in your questions and we'll do our best to answer them. Let's discuss some of the newer symptoms of COVID-19, such as ang pagkawala ng pangamoy at panlasa natin. So to discuss more about this, we have on the show Dr. Theodore Carvajal, who is an ear, nose, throat, and head and neck surgeon. Welcome to the show, Dr. Teds.
Hi, good afternoon. Good afternoon, Fred.
Yes, Ted, one of the newer symptoms connected to COVID-19 is the loss of smell and taste in those who are positive. Why would something like this happen to someone who has the virus?
Basically, Fred, based on studies from abroad, um, symptoms like this is really very common, like loss of taste and loss of smell, because the virus itself has its own enzymes for that specific region, or for the specific loss of taste and smell, which which manifests in the disease. So basically, it could be in the early stages of the symptoms of COVID-19, um, from 1 to 2 weeks, and then it would sometimes resolve by itself.
Pero hindi ba, Doc Ted, hindi ba pangkaraniwan na nawawala ang panlasa at pangamoy kapag ang isang tao ay nagkakatrangkaso? Ano ang pagkakaiba nito
Ye-
sa isang positibo with COVID-19?
Actually, that's the thing that the doctors are trying to get a research about, because as we all know, all of the viruses that could cause ubo or sipon can cause loss of smell and taste, like upper respiratory tract infections, like um, adenovirus, rhinovirus. But in COVID, but on this virus, there's a specific virus, there's specific enzyme that can also cause the that can also cause the loss of taste and smell. So basically, as of now, it's still unknown why it does that, but there's ongoing studies or ongoing researches that say that this loss of taste and smell should be one of the major criteria for COVID-19 patients.
Okay. Yeah, so kailangan natin na abangan yung mga data with those ongoing research para mas maliwanagan tayo
Yeah.
with this newer symptoms ng COVID-19. Okay, so before
Yes.
we answer
Yes.
some more of your questions online, marami rin nagtatanong, Ted, ano, dahil nga summer ngayon, pero bawal pumunta sa mga beach. Alam naman natin yan because of social distancing and whatnot. Marami ang gumagawa ng mga improvised swimming pool sa kanilang bahay. What kind of ear problems can people watch out for when in the water?
Usually, swimming. Usually, common symptoms would be the otitis externa, or the ear pain, what we call ear pain. So water goes into the ear canal, and then sometimes stays there, and then after that, it causes pain. So basically, that's one of the most common symptoms for that.
Okay, so at least that's something to watch out for. Now let's answer some more questions online. We have a question from Jose. Once nalanghap ang COVID-19, may epekto po ba ito kaagad sa katawan ng tao?
Actually, in ENT point of view, or in our point of view, um, basically the COVID-19 are targeting the lungs itself, and then major symptoms would be the colds, cough, and then loss of taste and loss of smell, and sometimes headache, headache, and migraine. Basically, those symptoms would coincide with COVID-19. As per, if ever your immune system is strong enough, you could bypass that, and you would cure by itself.
Okay, we have another question from Pedring. Marami po ang gumagawa ngayon ng improvised swimming pools at walang chlorine ang tubig. Delikado po ba ang tubig dito kapag nakapasok sa tenga?
Usually, stagnant water, pag natagalan na siya, naarawan na siya, mas dumudumi yung tubig. Ingatan lang lagi na hindi mapasukan o magstay yung tubig sa loob ng tenga, sa loob ng tenga. Basically, after you swim, you rinse your ears well. Avoid cleaning vigorously sa loob ng tenga with earbuds. So basically, para hindi siya mamaga or masugatan sa loob ng tenga, which entails, if ever like that, would cause ear discharge or ear pain.
Ayan, itong third question natin from Mikey, medyo konektado dun sa question number 2. Ano po ang karaniwang sintomas ng ear infections?
Usually, ear infections would be, number 1, ear pain. Number 2, parang humina ng konti ang pandinig mo kasi may bumara. Number 3, meron siyang parang ugong na naririnig. And number 4, usually yung malala, minsan nilalagnat kapag malalang malala na siya.
Okay, those are very good advice from Dr. Theodore Carvajal. Do you have a message for our viewers, Dr. Teds?
So, stay home, stay safe, less burden to us frontliners, and keep healthy.
Very good. Short and sweet from Dr. Teds. Thank you very much for joining us and sharing your expertise with these new symptoms that are cropping up, and as well some advice on how to take care or spot some ear problems from us. Thank you again for joining us.
Thanks.
When the doctor is in returns, let's talk about oral health naman in this time of pandemic. We'll be right back. Keep it here on CNN Philippines. Hello and welcome back to The Doctor is In, and thank you for sending your questions through CNN Philippines social media accounts. Pag-usapan naman natin ang oral health. So maraming dental clinics ngayon ang pansamantalang nakasara pa dahil sa COVID-19. Makausap natin ngayon si Dr. Rochelle Javier. Siya ang presidente ng UP Dental Alumni Association para alamin kung ano ang options available for oral healthcare sa panahon na ito. Welcome to the program, Dr. Javier.
Thank you for having me. Good afternoon, sir.
Now, ano ang mga pagkain at inumin ang mas nakakapagpabilis ng pagsira ng ipin, Dr. Javier?
Okay, so that question has never been more significant as to yung current situation po natin. So most of us have been stuck at home for almost 2 months. So lahat po tayong ginagawa lang dito, kumakain, aside from watching and doing other things. Yung mga gusto po natin kinakain, yung sugary drinks, food that is very starchy, na yung may carbohydrates po, carbonated drinks, artificially sweetened juices, yan po yung favorite natin. Unfortunately, yan din po ang favorite ng oral bacteria. Kaya hindi po advantageous na yun ang i-take natin. And sir, ang sabi
Yes,
po nga nila,
sugary drinks, always the culprit.
Yes, sir. And sabi nga nila, ang food impacts dentistry in 3 ways. The kind of food that we eat, how often we eat it, and when we eat it. So, hindi naman po sinasabing, wag na natin siyang kainin. Pero kung time to eat it, yun po, sir.
Yeah, so always in moderation. Ngayon, madami sa atin ang pagtutoothbrush ang pangunahing paraan ng pag-alaga ng ipin or tawagin ang oral hygiene nila, no? Sapat na ba ito, Dr. Javier? And if so, gaano kadalas ba dapat magsipilyo ang isang tao?
Okay, sir. Ang minimum na nire-recommend po natin is at least 2 times a day. When we wake up in the morning at bago po matulog sa gabi. Why when we wake up in the morning? Kasi po, pag natutulog tayo, yung saliva natin, nagre-rest lang po yan. Design dapat siya nag-flow, pero nakahiga pa, steady lang po yung position mo, hindi siya nag-flow. Kaya minsan pagising natin, di ba po, parang feeling natin, our breath is not that, it doesn't smell as good. So because po, na hindi na-flush away yung bacteria ng saliva. So ideally po, dapat pagising natin, we brush our teeth. At ganoon naman po, bago matulog, gusto na po natin yung mga kinain natin at mga naiwan ay matanggal bago naman po tayo matulog. Yun po, sir.
Ang paggamit ba ng dental floss, Doctor, ay optional kung tawagin? Or kasing halaga ba ang pagde-dental floss, kasing halaga ba ito ng pagsisipilyo ng ipin?
o dental flossing is just as important, at least po once a day. Why? Yung paghahit po tayo ng toothbrush, hindi po natatanggal lahat ng mga nakasiksik in between the teeth. Ang sabi nga po, maganda mag-floss ka bago mag-toothbrush para po natanggal mo yung mga naiiwan in between, when you brush your teeth, nakukuha mo yung benefits po ng nandun sa toothpaste, which is like fluoride, nasisingit po siya dun sa mga pinagtanggalan na spaces. Para po optimum yung makukuha nating effect ng fluoride and everything that is good that you will find in your toothpaste.
Okay, very good advice. Now let's go to our last set of social media questions. Our first one is from Catherine. Ano po ang karaniwang dahilan kung bakit sumasakit ang gums?
Okay, thank you, Catherine. Marami pong dahilan ng pagsakit ng gums. Pwede po ang gums sumasakit dahil po sa sakit ng ngipin. So that could be because you may have a tooth abscess, may infection na po. Or maaari naman po, ang sakit ng gums ay dahil po talagang may inflammation po yung gums natin. Ang pinakamaganda ho kasi talaga, prevention. Kung tayo bumibisita sa ating dentist regularly, ito po, naiiwasan natin. Yes, sir.
Great. And our second question is from Leonil. Magkasing effective po ba ang pagtutoothbrush at paggamit ng mouthwash?
Both are beneficial, pero hindi po yan substitute for each other. Ang importante po makapag-toothbrush tayo para mag-lower po ang bacteria. At pag tayo din po ay nagmumumog, meron din po mga bacteria na natatanggal after we rinse our mouth. Pero hindi po substitute yung isa para dun po sa
Great.
isa.
So, yes, I agree with that. So one should not be a mouthwash, hindi dapat substitute sa tamang pag-toothbrush. Ngayon, our third and last question is from Dan. Gaano po tayo dapat katagal nagtutoothbrush?
Okay. Kagaya po ng recommended hand washing, di ba 2 minutes po. At least 2 minutes makapag-toothbrush po tayo. Ang sinasuggest nga namin, kung nanonood ka ng TV, magtapos ka ng 2 o 3 commercials, para na timing, or lalo kung bata, maganda ma-develop siya, lagyan niyo po ng maliit na timer sa bathroom, sa sink, para natututo siya at nasasanay. Pag ang bata po kasi below 6 years old, dapat po inaano natin yan, minomonitor natin po si toothbrush. Tinuturo natin, tina-timing, para the child develops a good habit ng toothbrushing. Yes.
Okay, those were good advice, definitely from Dr. Javier. All things with regards to taking care of our teeth as well as our gums. Now, Dr. Javier, there's this thing called the dentista para sa bayan. How does this work, and could you talk more about this, please?
Okay. So when we put up that online consultation po, it was ang intention po namin to give sound dental advice habang ECQ. Ang nangyayari po kasi tayo mga Pilipino at a loss tayo. Wala tayong mapuntahang dentista, maaaring wala din pong matawagan kasi ang landline hindi naman nila makausap. So we put that up para po to address the concerns of the Filipino public, anything about yung dental concerns nila. Originally po dapat, ano lang po yan, for emergency. Pero nung after a while, tinatakal na rin po namin ibang mga problems. Ang ginagawa po namin, hindi lang po, we don't offer cure. Ang ino-offer po namin is relief. No? Tapos po, ang pinakamalaki din nagagawa namin, I think, is yung assurance sa kanila na may nakakausap silang expert. Minsan ho kasi, pag naiiwan tayo sa sa bahay, no, you're left with your own devices, nag-iisip ka, marami kang anxiety. Pero dahil po na-assure sila, kinakausap sila isang specialist, natutulungan pong yung pag-aalinlangan nila ay mabawasan po. So we put that up March 22.
Okay, very good. So
Tapos po, sir, we also have a Twitter page, no, Twitter account. So during the ECQ, we were running it from 8 in the morning to 10 in the evening, Monday to Sunday. Yun po.
Okay, very well, very good. Now, Doctor, really quick before we go, could you give our viewers some quick tips on how to take care of their teeth or how to have good oral hygiene?
Okay. Gaya po nasabi ko, brush your teeth 2 times a day when you wake up in the morning at bago po tayo matulog. At least 2 minutes po ang pagtutoothbrush. Floss at least once a day. Tapos po, kung kinakailangan po, lalo hindi nga mangyayari sa panahon ngayon, sana po bumisit tayo ng dentist at least 2 times a year. And lastly po, I just have to emphasize on food kasi yun na lang po pwede natin gawin ngayon, oral hygiene at saka yung diet po natin. Try to eat food po na tinatawag ng detersive, yung medyo coarse, para may natural toothbrushing effect po yan, natural brushing. Gaya po ng apples, pears, celery, yung medyo rough po. Ang celery nga doon, parang sinasabi ng natural dental floss daw yan eh. And then, ang cheese po, yung nag-i-induce po ng paglalaway para po naka-flush out yung bacteria natin. Yun lang po.
Okay, thank you very much, Dr. Javier, for joining our show and sharing all those tips with our viewers.
Thank you for having me. Have a good day.
And thank you also to all our viewers for sending in your questions. I'm Dr. Freddie Gomez, and we'll see you again tomorrow at 3:30 p.m. Stay safe, everyone.